Good evening. Welcome to tonight's talk by Dr. Alexea Gaffney, infectious disease survivor, thriver, infectious disease mom. Thank you so much for coming on to kick off October, as we know how imperative it is to educate women. I'm Tracy Milgram Posner, the founder of BRCA Strong, where we inspire, educate, advocate, and empower survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. We fund women post-mastectomy garments, lymphedema sleeves, and pillows in need. And again, thank you, Dr. Alexea, for coming on tonight to share your story, as I feel it is so imperative in our community to make sure that we share our stories and get the knowledge out there. And your story is so powerful. We've been following each other for a long time. We've had you on before, and tonight we're going to take a little bit of a different angle. It's kind of like her actual story. Instead of speaking on infectious disease, maybe we're going to talk about other couple facts, but focusing on the story as an individual, from a physician to a mom and life. So thank you so much for coming on again tonight. I really appreciate it.
Thank you so much for having me. And I've shared my story, but in so many different platforms in so many different ways and from so many different angles. And it's interesting that when I share it, each time I share it, whether it's with slides or not, it's always a little bit different in terms of the information that is brought to the table. And as I learn more as a breast cancer survivor and as a breast cancer advocate, the way I share my story changes and evolves, because there's so many teaching points in what my experience was. So one of the things that I'm very clear on, as a physician and as a breast cancer survivor, is, the difference between health and wellness. And, health is, either you're healthy or not. Health is literally just the absence of any sort of disease state. And so until I was at risk for breast cancer, when I was diagnosed with LCIS, or until I was definitively diagnosed with breast cancer, I was considered to be a healthy person. But I was not well. And, I was not in a state of being that provided me with a life of wellness. I always tell people, and breast cancer survivors will argue me down and fight me on this. I don't have it that I gave myself breast cancer, but I wonder if in the state of my genetic mutation, is it possible that I would have gotten breast cancer not at 37, but maybe at 67 or 73 if my lifestyle was a little bit different, So in medicine and in science, we always talk about nature. So what is our genetic makeup? What are we genetically programmed to be and do, and then our nurture, right? How are we raised? What is the environment we live in? How do we treat and care for our bodies? And, what are our outcomes going to be based on our nature versus nurture? And this is studied in twins that were separated at birth, and what their outcomes are in terms of their intellectual abilities and their physical stature and status and health outcomes based on the environment in which they were raised, if it's significantly different. So we know, nature versus nurture plays a role. So I am gonna pull up my slides because I think there's some important points to be made about my story. And this is an old presentation. This is before I was a seasoned presenter. So it looks a lot different than some of my other slides, but I think it brings up some important points. So let's see. I'm moving my screen around. I don't know. Y'all see my slide that I'm sharing? Okay, perfect. So I think I might have given this presentation at my church or something. So, I was talking about my life before cancer, right? And we all who have experienced breast cancer or who have found out that we have a genetic mutation, I would say probably your before cancer state is your before knowing you had a mutation state and before cancer was thrown into your life. So the picture on the left in the white coat is like, kind of what everybody thinks my life looks like. I'm this, cutesy bootsy doctor, and I dress cute, and my hair's nice, and I weigh the right amount, and I'm just smiling, and life is good. But the reality is, that's what my life looked like, in the office, super late hours. That's my daughter, like literally pulling at me, and I'm like trying to type notes and submit bills over her. And like my life is in the chaos of exactly what my desk looks like. And my boyfriend at the time actually snapped that picture of me going through those motions with my daughter. And that was like so typical of my life, like just completely lacking balance, working all the time. When I wasn't working, I was parenting. Sometimes I was parenting in the midst of working. I ate very terribly for quite some time. I lived on carbs and caffeine. I got very little sleep, and I really didn't exercise at all. I worked, I parented, squozen relationship, worked, parented, and I lived in this unhealthy rut for quite a while. And then I found a lump in my breast at 35. That lump turned out to be LCIS, or lobular carcinoma in situ. And I found out that I was, at risk for breast cancer. As a result of that, I started trying to find and seek balance in my life, but I wasn't doing as good of a job at it as I could have or should have. And it was just because I didn't know what I didn't know, So the picture on the right is, just represents like trying to get some balance and trying to live a healthy lifestyle, because that's what I was seeking. I was seeking health. So I was seeking the right numbers on the scale. So I lost like 24, 26 pounds, because in my mind as a medical doctor, I knew that, being overweight or obese is linked to increased risk of breast cancer. So I started exercising and eating a little better to lose weight, but I still was kind of living in that state of unwellness, of being unwell. So I still was running on fumes, not sleeping enough, not taking time for self-care. And I was just incredibly stressed all the time. And, some people will get upset when you talk about how stress affects the body, because I don't think they understand the impact of it. But when you stress, stress has real physical implications. So your heart rate increases, your muscles tense up or spasm. It increases your stress hormones like cortisol, which have impacts on your sugar. And stress actually literally shortens your DNA. So we have these things called telomeres on the ends of our DNA. And the telomeres get shorter and shorter and shorter as we age. And so if we can, age our DNA prematurely with stress, and you're predisposed to cancer through a genetic mutation, and you don't live a life that is healthy and well, in my mind, I'm probably creating and generating lots of abnormal cells, and my mutated DNA doesn't clean them up like it normally would, or my suppressed immune system doesn't fight and attack cancer cells like it normally would or should. And so, that's, why I question, would I have had cancer at 37 or 67 or 73 if I had a life that was more healthy? Now, these are not ideas that I ever considered until I was sick. And I'll talk about why I never considered that before. So we know, breast cancer facts. We are opening up October or Pinktober, however you call it, Breast Cancer Awareness Month. And so we can't not talk about breast cancer facts. So we know it's the most common cancer in women, and there is a 1 in 8 lifetime risk of breast cancer for women. It used to be 1 in 11, so the incidence of breast cancer has gone up over the years, and all women are at risk. We know that for those of us on the call who have genetic mutations, we do make up the minority of women who experience breast cancer, but those of us who have breast cancer mutations, the odds of us getting a breast cancer diagnosis is really high. You know, something like 70 to high 80% range for certain mutations. So they say that breast cancer is typically a disease of older women, but how many young women are in this space and come to this space in this community, and how many young women do we know with breast cancer? So we have to really bust up that myth so that we don't have young women ignoring their symptoms and you know, not appreciating their risk and not doing things like self-breast exams. And then we have to remember that men also get diagnosed with breast cancer, but as opposed to women who are 1 in 8 with lifetime risk, for men, it's 1 in 833 men get breast cancer, but of course, much more if they have a genetic mutation, like a BRCA mutation. So there's a picture of me at one of my many breast ultrasounds. And so after I found this lump and was diagnosed with Alexeas at 35, I was then given a lumpectomy, which showed other abnormalities. So it showed a fibroadenoma, atypical lobular hyperplasia, and more LCIS, kind of all jumbled up in one mass. And so I went on an every 3-month screening protocol for breast cancer, just like you would if you had a mutation based on that pathology alone. So in this picture, I'm actually laying on the ultrasound exam table, waiting for the breast radiologist to come in and do some additional images and give me an immediate read. And I will say at that time in my life, I honestly thought that, like, if I'm going to get breast cancer, I had more time. Like, I didn't think this was going to be something that happened in my life in 2 years. I thought, you know, maybe I got 10 years, maybe I have 20 years. Like, I'm not going to get breast cancer at 37. And so I was a little bit oblivious. So I'm definitely a stand for sharing my story so that young women know that they too are at risk. So, I'm often surprised that so many people don't know that there's more than just a mammogram to screen or do surveillance for breast cancer. So of course, there's self-breast examination that you do on yourself on a monthly basis. If you've already achieved menopause, or if you're in chemical menopause, then you do it once a month at the time of the month that works best for you. And if you are menstruating as a young woman, then you do it a week after your menstrual period. And that's so that your breasts aren't necessarily tender or sort of lumpy bumpy, or if you have cystic breasts, that does not interfere with your self-breast examination. And then, you know, mammogram is kind of our classic screening for breast cancer in women who are 40 and older, and for women who don't have dense breasts. So if a woman has dense breasts, then a mammogram alone, regardless of her age, is often insufficient to do a breast cancer screening. And I have so many patients who, you know, come into my practice and they've been getting, you know, just a mammogram alone, and they have dense breasts. And having dense breasts puts you at a slightly increased risk for getting breast cancer. And I had very dense breasts. In fact, when I had the LCIS and the lumpectomy, and I was getting these mammograms and ultrasounds, they actually put me on tamoxifen to try to decrease my risk for a breast cancer occurrence or diagnosis, but also to help decrease the density of my breast so that screening would be a little bit easier. And let me tell you, tamoxifen worked. My breasts got so much softer than they had been before I was on tamoxifen, and I lost like a whole cup of bra size when I was on tamoxifen. So between tamoxifen therapy, the 24 pounds of weight loss, and all these biopsies and lumpectomies that I was having, my self-breast examinations got a little difficult because I didn't have twins and I didn't even have sisters anymore. I had like first or second cousins for boobs. So I was really, really relying on my breast imaging to know what was going on in my breast. So I had every 3 month cycles with mammograms and breast ultrasounds paired together. And those were alternating with breast MRIs, which are no fun at all. But I'm proud to say I do them without sedation and without benzos, which is apparently a big deal. So, you know, we all know symptoms of breast cancer, but I think that I think it's always great to take the opportunity to reiterate symptoms. Now, a lot of doctors will tell you that breast pain is not a sign of breast cancer, and I'll say it's not maybe the most common sign of cancer, and that just because your breast is painful does not mean that you had cancer. But I actually had this very vague, dull, aching breast pain in my right breast where my cancer was ultimately diagnosed for a couple of months prior to my diagnosis. And because I was getting screened so routinely, I just kind of ignored it. And I didn't bring it to my doctor's attention when I was in those in-between periods between getting my ultrasounds. So of course, lumps and bumps. And if a woman really knows her breast and routinely performs self-breast examinations, then she's more likely to bring her cancer to her doctor's attention and contribute to her own diagnosis of breast cancer. So that happens around 40% of the time if a woman finds a lump on self-breast examination. That's how 40% of breast cancers are diagnosed. So that's huge. And when you know your breast, you'll be surprised what you could find. I started doing self-breast exams when I was 20 or 21, and I started as an undergrad because I met this young woman. Oh God, her name escapes me right now. I want to say her name is not Regina Lewis. I can't think of her first name, but her last name is Lewis, and she was misdiagnosed, or she had a delayed diagnosis of breast cancer. She started bringing a breast mass to her doctor's attention when she was like 16, and they kept telling her she's too young to have breast cancer. Nothing was wrong, and she basically was ignored until she couldn't be ignored anymore at 21, and she was diagnosed with metastatic breast cancer. So by the time she was age 25, and still in treatment for metastatic breast cancer, she began to tour college campuses and share her story with young women and teach them about, you know, breast self-awareness and self-breast examination. And after meeting this young woman, I examined my breasts every single month afterwards. You know, I had my self-breast exam sticker on the mirror in my dorm room, and I took it with me to home when I graduated college and had it with me all through med school. But shortly before I graduated college, I found my first breast lump. And it was like the size of like a nerd's candy. It was tiny, but it was dense, and it was distinctly there and not on the other side. And so I continued to follow it. It turned from a nerd's candy to a pea to a marble. And when it became a marble, I brought it to my grandmother's attention. And at the time, we were taking care of my grandfather, who was actively dying of metastatic prostate cancer. So there goes my family history. He had very aggressive metastatic prostate cancer. So I was navigating the healthcare system as a young Black woman who had no health insurance and was dealing with a breast mass. So of course, all I wanted somebody to tell me was, is this cancer or not? And to like really, truly investigate it. So it would take over another 3 to 6 months to get a definitive, well, not even a definitive diagnosis, I suspect this is a fibroadenoma, which is benign and not cancer, and I think you'll be okay. It finally got confirmed a year later when it was removed, because it grew from, you know, that pea to a marble to like a big kind of amorphous blob that was painful and had to be removed. And it was confirmed a year later that it was a fibroadenoma. So breast pain, lumps, swelling in the armpits, fatigue. I had loads of fatigue before my cancer diagnosis. Sorry, y'all. I had loads of fatigue before I was diagnosed with my breast cancer, and I had been experiencing that fatigue for quite a few months. And, you know, I talked to you guys already about how hard I worked and that I didn't eat well and all of that. But even in spite of how poorly I treated my body, like I could always go. I always had energy. And this fatigue was like, I was barely making it through the workday. I was drinking more coffee than ever. I was doing whatever I could to simply get through my patient volume. And I would come home, I would scoop my daughter up from the aftercare program at her school, and I would dive into bed. I would feed her and I would tell her, like, listen, I'm going to sleep, turn the TV off at whatever time, you know, and I would be out and I would sleep till the next morning. Sometimes I was falling asleep at 6:30, 7 o'clock at night, and I'd sleep till the next day and be absolutely exhausted. So, you know, when your energy levels change like that, when you're just sort of crashing and burning, it's a sign that something's wrong. And it doesn't always mean cancer. It could be any number of things, infection, you know, anemia, thyroid dysfunction. It could be so many things, but it needs to be brought to someone's attention. And I just, you know, kind of relied on, I was having screening, and so at least it wasn't cancer. Unexplained weight loss can be an issue. And then, of course, we know the common signs or symptoms. So dimpling of the skin can get a thickened or orange-like appearance. Inflammatory breast cancer can be associated with like redness, heat, and rapid swelling of the breast. Skin irritation, really excessive itching of the skin. Nipple discharge, especially if it's bloody, can be a sign of cancer. So, you know, one of the things that we also have to remember is that breast cancer is not just one particular disease, right? There's so many varieties of breast cancer and so many ways in which breast cancer can present. So I had an invasive ductal carcinoma. So, oh, excuse me. No, I didn't. Sorry. I had an invasive lobular carcinoma. So invasive lobular carcinoma only makes up about 10 to 15% of breast cancer, whereas invasive ductal carcinoma is what most women have. So it's 80% of all breast cancers, and it involves the milk ducts. And then there's other types of breast cancer as well. So when we talk about breast cancers, we're talking about, you know, is there estrogen or progesterone receptors? Is there a HER2 receptor? Is it, you know, triple negative? Is it triple positive? And that, you know, impacts the way that we are treated. So my cancer was PR positive and HER2 negative. And I know that these are things that many of you know about, but I think it's always great to just kind of reiterate. So, you know, what type of cancer we have, is it receptor positive or not, will determine our treatment path. Some of the things that we need to also understand is our risk for breast cancer. So again, we talked about, I don't remember if it was when I started the presentation or just when we were chatting, but 85% of breast cancer patients have no family history. So no family history does not take you out of the risk for breast cancer. And then there's certain lifestyle risk factors. So women who drink excessively have a 50% higher chance of getting breast cancer. And so, you know, as we were approaching Pinktober and the pink washing was already beginning in mid-September, it just struck me as very interesting that there was a particular winemaker that had an ad with a pink ribbon on their wine bottle and, you know, pink corks. And that's not to say that I don't enjoy a glass of wine. I do love a glass of wine. I just was curious what was the language or messaging around that particular advertisement, and if they're actually donating dollars to breast cancer awareness, breast cancer research, if they're donating money to breast cancer survivors and thrivers and metavivors, or, you know, small organizations like Reconstruction that are really touching the community, or are we just a money grab for them in October? I mentioned dense breasts, carrying a greater risk of breast cancer, obesity, inactive lifestyle. So for me, those were risk factors that I became keenly aware of. and then other toxic habits that can increase the risk of cancer, like smoking, and certain types of dietary and lifestyle factors. So these are my parents here on the left, and my dad had prostate cancer as well. My dad, interestingly, got prostate cancer 20 years earlier than his father was diagnosed with prostate cancer. And so again, that made me question, how much of lifestyle plays a role. So when I was younger and in my teenage years, my parents kind of had a toxic lifestyle. And, my grandfather and my father's lifestyle and their dietary habits were so completely different that I just always wondered, did my dad get his prostate cancer 20 years earlier than his father because of what his lifestyle might have contributed? So in terms of my breast cancer journey and treatment, so I was diagnosed by MRI with a large breast mass at 37 years old. So I mentioned already that I was being screened for breast cancer every 3 months, and that screening was ongoing, alternating MRIs with mammograms and ultrasounds until August of 2017. So August 2017, I go in for my routine breast MRI, and there is what the radiologist described as schmutz on my right breast in the lateral aspect of the breast. And he he suggested a breast MRI because it appeared to be a new finding compared to the year prior. Now, I was in the care of a breast oncologist and a breast surgeon, and I saw both of them every 3 months. And my breast surgeon ordered the biopsy, and just by coincidence, I had a follow-up appointment with the breast oncologist. And when she found out I was going for yet another biopsy that afternoon, she said to me, "Girl, they are going to make a pincushion out of you." She said, "You're a young Black woman, you're high risk for breast cancer, and every time they see anything, they're going to stick a needle in it." And, she thought it was too aggressive. So her request was that I go get the disc of my previous MRI, which had been done at an outside radiology company, bring it to our hospital, and have the breast radiologist look at it before deciding on getting this MRI guided biopsy. So I did exactly what she asked me to do. I went and got this disc, and she and I stood over the radiologist's shoulder, and he pulled up the images and he compared them side by side. And he's like, "Well, the other radiologist, whoever read this, didn't mention this schmutz, but it was there a year ago and it's not significantly different. I don't think you need this biopsy." And so he canceled the biopsy that day. And she decided that I should get my next imaging in 6 months since I didn't have a change for a year. So, I skipped my next imaging at 3 months. And then in February of 2018, I had a mammogram and a breast ultrasound, which were unremarkable, which is great. I skipped out of the office, happy as a clam. Even though I'm still tired, still fatigued, and my boob is still aching, I was just like, well, I ain't got breast cancer. And so I just carried on with my little lifestyle. So 2 weeks after that, I saw my breast surgeon for regular follow-up. He did a clinical breast exam. He asked me had I felt any lumps or bumps. I had not. And he said, "Okay, well, we'll keep you on a 6-month screening protocol." And he ordered an MRI to be done 6 months from that time. I took off my hospital robe and began getting dressed, preparing to go from his office to my office and work. And he came back in and he said, "You know what? Let's just get an MRI now. Your last MRI was 6 months ago." He's like, "I know that screening that you just had was unremarkable, but I really think we should compare oranges to oranges. Let's just get an MRI." And when the MRI was done, like 3 weeks later, it showed a huge mass in my right breast in the same area where 6 months ago there had been schmutz that nobody felt was clinically significant and that had been lingering for a year. So a question that we of course all had was, was this just a very rapidly growing aggressive cancer that, just blossomed in 6 months, or was that schmutz cancer all along and then it just kind of grew more quickly in the last 6 months compared to what was going on in the past year? One of the things I will say is that I learned a huge lesson in going through all of this. And, that was the lesson of self-advocacy and the importance of getting second opinions. So in the midst of getting screened for breast cancer every 3 months and having multiple biopsies and lumpectomies, at some point I asked my surgeon and asked my breast oncologist if I was a candidate for a prophylactic mastectomy. And I did this at the advice of my primary care doctor, because before having cancer, this is not my wheelhouse. This is not stuff that I was typically talking about as an infectious disease doctor that was doing a little bit of primary care. And so it just wasn't something that I was very present to. But my primary care doctor was very adamant that I get a prophylactic bilateral mastectomy. She was like, you have 2 ticking time bombs on your chest and they're going to go off. You're a young Black woman. You're going to have aggressive cancer. Most likely, if you get it, your risk of dying from cancer is 40% higher. Like, she was quoting all the statistics. And she was like, you just need to cut them off and get a new pair. Like, this is ridiculous. And so she even accompanied me to one of my visits. And so when I was told that it was too radical to have a prophylactic mastectomy just based on, the same pathology over and over again, I said, well, what if I had a gene mutation? Like, why can't I just get genetic mutation? If I had like a BRCA gene or something, wouldn't that make me a candidate for one of these surgeries? And I was told that I was not a candidate based on my family history. I now know that to be incorrect. So my grandfather's history of aggressive prostate cancer made me a candidate. My father's history of prostate cancer made me a candidate. And the fact that I have a first or second cousin that had breast cancer in her 50s made me a candidate as well. But I was told that I wasn't a candidate. I was not sent to a genetic counselor until I got diagnosed with breast cancer based on this MRI. And then it became, oh my God, you're 37 and you're too young to have breast cancer. And so you need a genetic counselor. And that's how we found out that I have the PALB2 mutation and that I have the ATM gene variant. So ATM gene mutations are associated with breast cancer, and knowing your mutations impacts your treatment. So I was treated like a BRCA2 mutant would be treated if they had breast cancer. So I had adriamycin, cyclophosphamide, carboplatin, and Taxol. And then I had 25 cycles of radiation. So those are various pictures of me going through treatment. And but the interesting thing, and why I have the radiation slide, is because if I was a known ATM gene variant, they actually would not have given me radiation therapy because it increases your risk of subsequent cancers. So we kind of have to see if the ATM variant that I have in the future gets identified as a true mutation associated with cancer risk, and if the radiation therapy has any implications for me. But when I had my bilateral mastectomy, they found that my right breast mass was 9.5 centimeters in size, and I had a pretty small breast. I had 9 of 15 lymph nodes positive on axillary lymph node dissection, and then I had a small stage 1 cancer on the left that was not picked up in the ultrasound, the mammo, or the MRI that I had. And I chose to have my left breast removed, and I opted for implant reconstruction. So, I talked about not being well. And I knew that as a physician, someone who believes in evidence-based medicine, someone who is like super sciencey, I also knew that I wanted to consider complementary and alternative therapy, and that I really wanted to use some unconventional therapies along with my conventional cancer treatment. So, my boyfriend is very crunchy granola. And he was like, you already had these lymph nodes removed. You already had the mastectomy. Like, all the cancer should be cut out of your body. And you just need to be, vegan and drink these teas, and, and you'll be done with cancer. You don't need to have chemo. And so it's a huge source of contention for us. But, ultimately, I am of the mindset that you treat based on the evidence, right? And so I did my conventional treatment, surgery, chemo, radiation, and I'm remain on hormone suppressive therapy at this time. But I also entered into the realm of, wellness. And so I was very conscious of, what I was eating, what I was drinking, and what my mindset was. So I started researching, like, what are cancer fighting foods? And I think we all know, that we should be eating foods that are rich in antioxidants, like berries. Teas are also rich in antioxidants. And so I drank a lot of tea because I couldn't stand the taste of water. It tastes like burnt plastic to me. And so literally the only way I could hydrate was to drink tea. So I was very intentional about which teas I drank. So I drank a lot of soursop tea, a lot of lemongrass tea, a lot of green and black tea, matcha, moringa, so many different varieties of tea. I flavored them with citrus fruits. I ate berries every single day in some shape, form, or fashion. And I really tried to eat well. My personal experience was that when I ate poorly, because of course you crave things or you can only taste certain things. When I ate poorly, the way I experienced side effects of chemo was much worse than when I ate things that were very clean, when I ate a lot of green veggies and a lot of fresh fruits. And in the beginning, I actually maintained a pretty healthy weight. But when I went back to work and I started eating like a working person again, eating things on the go, I actually picked up weight. I really need to go back to eating the way I did more consistently when I was on chemo. So, I was also clear on mindset. And so I'm a woman of faith. I believe in God. I pray. I believe that, our spiritual health and well-being is also super important as we go through life in general, but especially as we go through a cancer treatment journey. So from the beginning, I just said I was going to choose joy, and that I was going to be in the practice of gratitude, and that no matter how bad or hard things got, I was going to find something to be grateful and thankful for every single day throughout the treatment. And so in the beginning of this, when I got diagnosed with my cancer, my sister said, well, so you've got this diagnosis, all of these things now, like, what are you going to do? This is before my surgery, before I started chemo or anything. And I said, Kimmy, I'm just going to lemonade this shit. Like, I am going to just find the lemonade and the lemons all throughout this, because of course, as a physician, I kind of was in the crappy position of knowing exactly what I was in for. And that's kind of sucky when you know that I'm going to get this chemo and I'm going to feel terrible. It's going to make me nauseous. I'm going to puke. I may get stomach ulcers. I may get mouth sores. I may get all these things. So it was just kind of like, it was a gift and a curse to know what was ahead of me, and be able to, come up with strategies for how am I going to deal with this naturally, because I'm one of those people who, if there's a terrible side effect to be had, I'm going to get it. I was on an antibiotic one time, and less than 1% of people get a tongue ache on the antibiotic, I felt like I was lifting dumbbells with my tongue. And so I get all the terrible, stupid side effects of everything. You know, I was nauseous, like we all get nauseous on chemo, or if you've had that experience. And Zofran gave me massive headaches, so I couldn't take it. But I learned that, you know, I can drink ginger tea or chew on ginger and, you know, suck on ginger candies or peppermints to manage my nausea, or I used peppermint oil and lemon oil to help with the nausea that I was experiencing, because medications just weren't always an option. So I practiced gratitude, and I began to journal my heart out, and I began to write down like the lemonade every day that there was a lemon. And I just had like my family and friends and community surrounding me throughout it. So I was like never alone. So this picture here on the right, I don't know if you guys see the little dot. So where I'm in the surgical gown. So this is my boyfriend over my left shoulder, and my ex-husband in the blue sweater in the back. And my parents and my best friends are who accompanied me to the OR the day I had my mastectomy. So many things happened. So many milestones happened during my cancer treatment journey. And when I could go out, like when I wasn't too neutropenic, I would go out and socialize as much as I could and as safely as I could. And I tried to enjoy life as much as I could, which I think is important. You know, even though cancer treatment may be, you know, 6 months or 9 months or a year, depending on, or maybe even a lifetime, but it was so important for me to be surrounded by community and to share my journey with folks like yourself. And I shared in the midst of my treatment, like it gave me purpose, and having purpose is what kept me going. And then, you know, when you're fighting, you got to have your why. You know, why am I taking these awful drugs? Why am I putting up with, you know, nausea, vomiting, stuff coming everywhere out of my body, awful side effects, you know, losing my hair, losing body parts. Happy birthday! Like, you know, remember your why. So for me, like my biggest why was my daughter. And I'm sure you are mommy's why, right? You're one of mommy's whys. And so my daughter was literally like my little helper. And there were days where I only got out of bed because my daughter Kennedy was like, Mommy, you didn't leave the bed all day. You didn't leave your bedroom all day. How about you just come down the hall to my room and you watch TV and I'll sit here and play. And like literally the first time I got out of the bed, other than to go to the bathroom, would be to come to her room. And she would like set me up with pillows and like put a teddy bear under my arm and like turn on HGTV. And she would just like play quietly with her dollhouse. Or one of our things is we live on Long Island. We live by the water. We love the beach. And she would say, Mommy, the sun didn't set yet. If you just throw on some leggings, I bet we can make it to the beach before the sun sets. And like sometimes that would be the only reason I left the house. So, you know, remember your why. Remember who outside of yourself you're fighting this battle for. And, you know, just remember to let the people who love you just really help you and carry you through this diagnosis. It makes all the difference in the world. So in the midst of all of this, I found my creative voice and I started developing my unique abilities. And so I realized that even though for my whole childhood and my teenage years, I didn't say anything. I didn't speak at all, as my mother tells it. I, you know, became a speaker, and I first just started sharing my diagnosis step by step, sharing what I was going through and what I was experiencing. And as a physician, like when I would go and join certain breast cancer communities or follow certain pages, one of the things that I noticed is that there's so much misinformation out there about cancer treatment and like complementary and alternative care. And so I really wanted to lend my voice to sharing what kinds of things work and are helpful in addition to, you know, going through treatment, like how important your diet is, how important something as simple as drinking and hydrating is, how important your mindset is, and, you know, just how important, you know, cultivating a life of not just health and wellness is to this cancer treatment journey. And so I created, I started just as Dr. Alexea sharing her cancer treatment journey. And then I created a line of nutritional supplements and created a couple of journals, which will finally, praise the Lord, be published this month. So my LLC is Passionately Purpose LLC. My website, dralexea.com, did launch just recently. I have a couple of blogs, and I'll be sharing blogs all throughout Breast Cancer Awareness Month. And I will tell you that as a breast cancer survivor, and as someone with a gene mutation and who is at risk for breast cancer and ovarian cancer, you know, now that we are in Pinktober, now that we're in October, now that we're in Breast Cancer Awareness Month, I am absolutely a stand for, you know, us taking our month back, you know, and for participating with organizations like BRCA Strong. I see Lakeisha's on from Pink Shoes, you know, taking a stand and, you know, letting the world know who's out there, who is truly doing work, who is truly supporting the women and men in our community who are either already diagnosed, at risk, surviving, thriving, metaviving with breast cancer, and encouraging people that, you know what, if you want to donate dollars, by all means do that, but know who you're giving your money to. So if that means giving it to Tracy for BRCA Strong so that she can give more products and services from her boutique to women who are affected by this disease, then let it be that. And so that she can continue to use her platform to spread awareness and education, and so that she can continue to have amazing speakers on and to offset, you know, her cost of living, because you're doing freaking amazing work, Tracy. And I know that you bust your butt, and it's time consuming. It's time away from your family. And, you know, it's not that we're here to use our diagnosis to make money, but at the end of the day, like your cost of living should be offset by, you know, as a result of what you're doing for this community. And so, you know, I'm a stand that we buy Tracy's tank top, not that we go buy a tank top at Walmart and maybe 1 penny is getting donated. You know, if you're going to go support breast cancer and you're spending $10, $15, $20, $1,000, $20,000, whatever it is, it needs to go to the people who are truly affected and impacted by this diagnosis, as well as the people who are using their platforms and using their voices to get the word out, to get people educated and informed and improve the quality of life for people living with, surviving, and thriving and metaviving with breast cancer. So that being said, I'm gonna climb off my soapbox. I thank y'all all so much for your time and attention. Tracy, I thank you for just letting me share, and I thank you all for just coming on and giving your time and attention, and I absolutely welcome any questions if anybody has them.
So if you guys have questions, feel free to raise your hand. We could start there. But I heard Dr. Alexea welcome Lakeisha, and you said a new foundation that I haven't heard. So I don't know if Lakeisha, you're available, you want to share, or Dr. Alexea, you want to tell me a little bit about it. I don't know if she's just listening in or available, but I'd love to hear more about it. And thank you for coming on for your support.
Yeah, so I know Lakeisha from, she's also a breast cancer survivor. Okay. And I'll let her share more if she chooses to unmute and come on. But she created Pink Shoes Incorporated, and I love
Hi. Oh,
her.
sorry.
There you go. Hi.
Hi. I'm not camera ready, so.
That's fine. Don't worry about
it. Gorgeous. You are camera ready.
Hi.
Hi.
So,
Mhm.
how are you?
I'm good. Thank you so much for coming on. I appreciate
I
it.
was trying to find it. I'm sorry I got on late. I'm like looking on Instagram Live and Facebook Live, and I messaged Alexia. I'm like, where are you at? Then I'm like, oh, they
Oh
said Zoom. It's on Zoom. So
no!
sorry I joined in late.
No problem.
But yeah, I have a nonprofit. It's called Pink Shoes Inc. And me and a friend of mine started it in 2011 when I was first diagnosed with breast cancer. I'm currently metastatic, but we offer financial assistance. We help women pay utility bills. We give them gas cards. They can help get to and from treatments, spa gift certificates, Christmas gifts to their children, Thanksgiving food baskets for them. Yeah, that's pretty much what I do.
Wow, that's an amazing support system. I'd love to maybe connect with you and see how we can collaborate. I know there's obviously women always needing different support systems. Um, I've never heard of you guys, so I definitely will look into it. And I'm sure I could follow you on Instagram or Facebook
Yes,
and
yes.
then figure out maybe how we can help each other. Our purpose is we fund women post-mastectomy garments. So those women
Okay.
who can't afford garments or lymphedema sleeves, we fund them. So maybe there's an opportunity if any of your women need garments, we'd be more than happy to see how we can
Right. And if
help them.
any of your women need a gas card or help with the utility bill or whatever, yeah,
Perfect. And do they have to be in active treatment?
there
Can
have to be an active treatment, yes, with
okay,
either chemotherapy or radiation or, you know, living with metastatic disease.
okay, perfect.
Yeah.
Well, I will definitely send you a message. Thank you so much for coming on. It's nice meeting you virtually.
Yes. I was like, oh, I gotta go check out my girl. Yes.
Yes, I'm so glad you came, and I love what Lakeisha says at Pink Shoe. She says we help in real life, you know,
Oh,
and
yeah.
That's
That's one of
important.
our
it's so
hashtags. I
important.
always, yeah. I started saying it because I feel like, you know, a lot of people profit off of breast cancer, you know, and everybody doesn't always help people.
Mhm.
And one of the things that I take pride in, you know, I've been dealing with breast cancer for since 2011 and now I'm metastatic. So even with my own self, you know, I take pride in the fact that we actually help real women in real life. We're a small organization. It's just me and a friend of mine who run it, but we still help in real life, you know? So I take pride in that.
100%. And there's not a lot of
Hmm.
organizations that, do that. And that's the problem in
Right.
real time and donating to other organizations that either we don't know where the money's going or what they're doing. I saw today, and one thing that I was taken back is like all these organizations are partnering with people, but then you look on their page and there's nothing what percentage is going back or where the percentage is going to. I'm like,
Exactly.
no, we're not doing this. Like clearly what we do is, we're on sponsorships, on grants and donations, and that's
Hmm.
it. My
Yep.
speakers, I have our speakers come on, we're honored enough to have so many physicians dedicate their time to us as we do like 2 physicians a week in different specialty areas. So we're always constantly touching base on something that has to do with breast cancer. It may tie in the gene or it may not. You don't have to have the gene to have funding by us, but just to be in real life, like no woman,
Right.
to me, no woman should ever go through this journey and say, nobody offered me a bra. I didn't know there was prosthetics. I didn't know there
Hmm.
was lymphedema sleeves, or, oh, my insurance doesn't cover them, so we just can't have
Hmm.
them. No, lymphedema is
Right.
dangerous. Why do we not want to offer these services? So
Yep.
no, thank you again for coming on, and I look forward to collaborating with you. I see we have a couple questions. Kate, you raised your hand? Hold on, you're muted. Hold on, unmute. Go ahead, Kate.
Wait, where does she live? Like, where's her company?
Oh, Lakeisha, she's on Long Island in New York.
Oh, cool. All right.
Yeah.
Kate's one of our
I'm in New York, but we our financial assistance is to women anywhere. You
Okay,
know,
so
because we
All
can
right.
always mail out your utility bill or send you a
Mhm.
gas card. However, our special sponsorships, which is like the Thanksgiving and Christmas shopping,
Mhm.
those is local because those are more intimate. We actually like go to your house and
Yeah.
drop off your Christmas gifts. So those is only for like Long Island and like, you know, New York City areas.
Right,
Oh,
perfect.
cool. Because we're in South Florida, but we have so many new followers, like all over the world.
New York is huge for us. It's very interesting. New York, California, Florida, and Texas are
Chicago lately too.
so perfect. Let's see. Did anybody else have any other questions for Dr. Alexea?
I have one question.
What?
First of all, thank you for sharing your story. I think you're very brave.
Thank you.
And